We are nearing the end of Breast Cancer Awareness Month, and no doubt you've heard a lot over the last few weeks about detection, prevention, and the search for a cure. But one thing that is not brought up as often: what happens after the cancer is gone and the patient has a life and a body to put back together? For today's Take Action Thursday, board-certified plastic surgeon Dr. Michele Shermak joins us. Good morning.
Good morning.
All right, so we have been talking about breast cancer all month long. This isn't something you talk about often, but when it does come time for reconstruction, do women wait until they've beat the cancer, have cleared that hurdle, and then start thinking about it?
They have options. So some women don't want to come out of surgery without a breast, so they can have immediate breast reconstruction, and nowadays almost anybody is a candidate for it. There are some women who need time to kind of wrap their head around the diagnosis and the cancer treatment and can't really think about all the details of that, so they can do it in a delayed fashion.
And for women like that, once they say, oh, maybe I'll just get a whole new lease on life, can they do other surgeries at the same time they're doing the breast reconstruction?
Absolutely. Absolutely. It's their time to kind of come back to where they were before, or even better.
Now, not every woman, though, going through breast cancer will need to have that kind of reconstruction, or does everyone need to have some form of it?
Not everybody does. I mean, more women are now getting lumpectomies, but even with having removal of a mass in their breast, there's going to be some residual asymmetry, and especially if you get radiation treatment, some women really do kind of tighten up and contract on that side. So there are lots of really great options now for partial breast reconstruction. We can do breast reduction techniques, breast lifts. We can do surgery on the opposite breast. So you really can actually wake up from surgery without having a mastectomy scar.
If someone is thinking about this, what are the types of questions that these women need to be asking their doctor?
Well, you want to make sure you go to a qualified doctor, and there are lots of doctors who are actually getting into reconstruction now. So you want to make sure you're with someone who is good, and you want to ask questions about all forms of reconstruction, because there's lots of information out there that might not be accurate. All
right. Well, Dr. Shermak, we're going to get you to stick around and answer some questions. Right after the break, Dr. Shermak will take your calls about breast reconstruction. If you have a question, our phone lines are open right now at 410-481-4545. You can also send us a tweet at Fox Baltimore or go through our Facebook page. 7:53 is the time. You're watching Fox 45 Morning News, all local, all morning. We are back with board-certified plastic surgeon Dr. Michele Shermak. She is taking your calls about breast reconstruction for our Take Action Thursday. We're going to get right to those questions. We have a lot of people. Keisha from Baltimore is on the line. Hi, Keisha.
Hi.
What's your question?
Well, basically, I have two questions. I had cancer back in 1991, and I had a complete mastectomy. I was at the age of 19.
Okay.
My first question is, I was given a prosthesis, but the problem is with these prostheses, every year I have to get one because it either breaks down or disfigured. My second question is plastic surgery or reconstruction surgery covered under medical assistance?
Okay. So the first question, she has a prosthesis. Maybe she's interested in reconstruction now.
Yeah. It's amazing. You were 19. Certainly, breast reconstruction is an option for you, absolutely. I mean, we see women who, like I said, they can't kind of deal with the cancer reconstruction at the time of cancer treatment, and you were so young. So you can do reconstruction at any time and learn about your options.
She was also asking about the cost of it. Is that covered under insurance?
Absolutely. Breast cancer reconstruction has been covered since the time of Clinton, and it's also covered for your opposite breast. So if you need surgery to match, that is absolutely covered since the late 90s.
That's good to know for women, because I'm sure that's got to be an expense that a lot of them can't deal with. All right, we had a caller who just dropped off the line, but they were asking, is there a place to go to get free or low-cost mammograms if you're uninsured?
That I'm not so sure about, but what I would suggest is that you contact the Komen Foundation or one of the breast cancer advocacy groups, because I'm sure that's what they're doing. They're getting funding for these types of things.
All right, let's go to Facebook. Mackenzie wrote in and said, what are the odds breast cancer could come back after reconstructive surgery? Are they greater?
The odds are low, very low. I would say it's probably on the order of about 5%. There is no finding another cancer, but usually if you have a full mastectomy, you really shouldn't have a recurrence.
All right. Well, thank you all for your calls and comments. And Dr. Shermak, thank you so much for your advice. Great advice for those folks.
Thank you.